Acquired immunodeficiency syndrome, or AIDS, is the late stage of infection with the human immunodeficiency virus, commonly known as HIV. This virus has been a significant global health issue since it was first identified in the early 1980s. HIV is a retrovirus that primarily targets the body's immune system, weakening its ability to fight off infections and diseases. Over time, if left untreated, HIV can lead to the development of AIDS, which is characterized by a severely compromised immune system and the occurrence of opportunistic infections or cancers that the body would normally be able to fend off. HIV targets the immune system, making the body vulnerable to various health problems. The virus specifically attacks CD4+ T cells, which are crucial for mounting an effective immune response. These cells play a vital role in signaling other immune cells to perform their functions. When HIV invades these cells, it replicates within them, eventually destroying them and reducing the body's ability to combat infections. The virus specifically attacks CD4+ T cells, crucial for immune response. As the number of these cells declines, the immune system becomes increasingly compromised. This makes the body more susceptible to a wide range of infections and diseases that it would otherwise be able to resist. The progression from HIV to AIDS can take several years, during which the virus continues to damage the immune system. Effective antiretroviral therapy, ART, can manage HIV and prevent progression to AIDS. ART involves a combination of medications that work together to suppress the replication of the virus. By keeping the viral load low, ART helps maintain higher levels of CD4+ T cells, thereby preserving the immune system's function. This treatment has transformed HIV from a fatal diagnosis to a manageable chronic condition for many people. ART suppresses HIV replication, allowing the immune system to recover. Patients on ART can lead healthier, longer lives, and the risk of transmitting the virus to others is significantly reduced. However, adherence to the medication regimen is crucial for the therapy to be effective. Regular monitoring and medical checkups are also essential to ensure the treatment is working and to manage any side effects. However, long-term infection can still lead to health complications, including those affecting the nervous system. Chronic HIV infection and the inflammation it causes can result in neurological issues such as cognitive impairment, motor dysfunction, and even psychiatric disorders. These complications highlight the importance of early diagnosis and consistent treatment. AIDS is a collection of symptoms and illnesses due to severe immune system weakening. When the immune system is extensively damaged, the body becomes vulnerable to opportunistic infections and certain cancers that are rarely seen in individuals with healthy immune systems. These conditions can be life-threatening and require immediate medical attention. Understanding AIDS is essential before exploring its link with neurological disorders. By comprehending how HIV progresses to AIDS and the impact it has on the body, we can better appreciate the complexities of managing this condition and the ongoing efforts to improve treatment and quality of life for those affected. The immune system is a complex network of cells, tissues, and organs that work together to protect the body from harmful pathogens like bacteria, viruses, fungi, and parasites. It acts as a defense mechanism, identifying and neutralizing threats to maintain health and prevent infections. Among the various components of the immune system, CD4+ T cells are key players. These cells, also known as helper T cells, are crucial in coordinating the immune response. They send signals to other cells, such as CD8+ T cells and B cells, to attack and eliminate pathogens. However, HIV, or human immunodeficiency virus, specifically targets and invades these CD4+ T cells. Once inside, the virus replicates, eventually destroying the host cells. This process significantly weakens the immune system, making it less effective at combating infections and diseases. To monitor the health of individuals with HIV, doctors regularly check the CD4 count. This count measures the number of CD4+ T cells in a cubic millimeter of blood. A higher count indicates a stronger immune system, while a lower count suggests a weakened defense. When the CD4 count drops below 200 cells per cubic millimeter, or if certain opportunistic infections are present, the individual is diagnosed with acquired immunodeficiency syndrome, or AIDS. This stage of HIV infection is characterized by severe immune system damage. Without a sufficient number of CD4+ T cells, the body struggles to fight off infections. This leaves individuals vulnerable to a range of illnesses that a healthy immune system would typically be able to control or eliminate. Opportunistic infections such as pneumonia, tuberculosis, and certain cancers take advantage of the weakened immune system. These infections can be more severe and harder to treat in individuals with HIV or AIDS. Additionally, chronic inflammation caused by HIV can contribute to ongoing immune dysregulation. This persistent state of inflammation can lead to further complications and health issues even when the virus is controlled with medication. This systematic dismantling of the body's defenses explains why individuals with AIDS are susceptible to a wide range of health issues. Understanding how HIV weakens the immune system highlights the importance of early detection, treatment, and ongoing medical care to manage the disease and maintain health. Neuropathy refers to nerve damage, causing numbness, tingling, muscle weakness, and pain. Nerves transmit signals between the brain, spinal cord, and the rest of the body. Damaged nerves disrupt these signals, leading to various symptoms. Symptoms vary depending on the type of nerves affected. Sensory nerve damage causes pain, tingling, or numbness. Motor nerve damage leads to muscle weakness or paralysis. Autonomic nerve damage affects involuntary functions like heart rate and digestion. Diagnosing neuropathy involves medical history, physical examination, and specialized tests. HIV can directly affect the nervous system, crossing the blood-brain barrier early in infection. This early invasion is a critical aspect of HIV's pathology, as it allows the virus to establish a foothold in the central nervous system. Once inside, HIV targets specific cells that play crucial roles in maintaining neural health and function. It infects cells like macrophages and microglia in the nervous system. These cells, which are part of the body's immune defense, become reservoirs for the virus. The infection of these cells disrupts their normal function, leading to a cascade of detrimental effects on the nervous system. Infected cells release toxic substances, damaging neurons and causing inflammation. This inflammation is not just a byproduct of the infection but a significant driver of the neurological damage seen in HIV patients. The toxic substances released by infected cells can lead to the death of neurons, further exacerbating the damage. This can lead to distal sensory polyneuropathy, DSPN, affecting the feet and hands. DSPN is one of the most common neurological complications of HIV, characterized by a range of sensory disturbances. Patients often experience discomfort that can significantly impact their quality of life. Symptoms include burning pain, tingling, and numbness, often symmetrical. These symptoms can be persistent and challenging to manage, requiring a comprehensive approach to treatment that addresses both the underlying HIV infection and the symptomatic relief of neuropathy. Direct neurotoxic effects of HIV are more prominent in later stages of the disease. As the disease progresses, the cumulative damage to the nervous system becomes more apparent, leading to more severe neurological symptoms and complications. Chronic inflammation from HIV creates a hostile environment for nerve cells. This ongoing inflammation can lead to a cycle of damage and repair that ultimately exhausts the nervous system's ability to recover, resulting in long-term deficits. Understanding HIV's direct impact on the nervous system is crucial for addressing neuropathy. By gaining a deeper insight into how HIV affects neural cells and the mechanisms behind the resulting damage, researchers and clinicians can develop more effective treatments to mitigate these effects and improve patient outcomes. Neuropathy in AIDS can also result from opportunistic infections due to a weakened immune system. Infections like cytomegalovirus, CMV, and varicella-zoster virus, VZV, can cause nerve damage. CMV polyradiculopathy involves inflammation of nerve roots leading to weakness and pain. VZV reactivation causes painful neuropathy in specific skin areas. Other infections like tuberculosis and fungal infections can also contribute to neuropathy. Managing opportunistic infections is crucial to reduce the risk of neuropathy in people with HIV. Some antiretroviral medications can cause drug-induced neuropathy. Older drugs like stavudine and didenosine were known for their neurotoxic potential. These drugs interfered with mitochondria in nerve cells, causing damage. Newer antiretroviral medications have better safety profiles and lower risk of neuropathy. However, nerve damage from older drugs may persist even after discontinuation. Monitoring for neuropathy symptoms is important in HIV care. Switching to alternative regimens may be necessary if neuropathy develops. Personalized treatment approaches are essential for managing HIV and neuropathy. Neuropathy is a common complication in individuals with HIV. Before effective ART, peripheral neuropathy affected a significant percentage of people with AIDS. With ART, the incidence of neuropathy from opportunistic infections has decreased. However, drug-induced neuropathy remains a concern with some RT regimens. Current estimates suggest 30 to 60% of people with HIV may experience peripheral neuropathy. Risk factors include advanced age, low CD4 counts, high viral load, and coexisting conditions. Recognizing neuropathy as a significant comorbidity is crucial for improving quality of life. Managing neuropathy in AIDS requires a multifaceted approach. Identifying and addressing reversible causes is the first step. Pharmacological treatments include antidepressants, anticonvulsants, and topical treatments. Opioid analgesics may be considered for severe pain but require careful monitoring. Non-pharmacological approaches like physical therapy and TENS can complement treatment. Lifestyle modifications and psychological support are also beneficial. Personalized treatment plans are essential for managing neuropathic pain. Improving quality of life is the primary goal in managing neuropathy in AIDS. Research is ongoing for more effective treatments for HIV-associated neuropathy. Scientists are exploring neuroprotective agents and nerve regeneration strategies. Targeted pain medications with fewer side effects are under investigation. Cannabis-based medicines show potential for neuropathic pain relief. Neuromodulation techniques like spinal cord stimulation offer promise for severe cases. Growth factors for nerve repair are a long-term goal. Comprehensive HIV management remains fundamental in preventing neuropathy. Continued research and innovative treatments provide hope for better relief and improved quality of life.